Hi there, I'm Semide, the student intern here at the ophthalmology clinic. So nice to meet you too. So I'm just going to grab your patient file. I will be completing your eye exam today as Dr. Patel is with another patient. Although I'm a student, I assure you that I am very well trained in eye exams. Okay, so taking a look at your intake here, I see that you have a family history of glaucoma. Is that right? I see your grandmother. I see. And so you are doing an eye exam to ensure that your eyes are perfectly functioning well with no abnormalities? Okay, perfect. I can do that for you. So I will start your exam, and then after we are done, I will call Dr. Patel over so that she can discuss the findings and do any other tests that she might have to do. Okay. And just so you know, the reason why we're whispering or speaking very softly here is because just across onto the other side, there is a family room and there are a bunch of babies sleeping in there. Yeah, so we have to keep it quiet. I hope that's okay. Okay, so I'm just going to step over to the other side of the room and wash my hands. I'll be right back. Now that my hands are all washed, I'm going to take your thermometer temperature. So just using this thermometer. Slips can be a little finicky at times, but there we go. So I'm just going to have you open your mouth, and I'm going to place it under your tongue. And if you can just close your mouth for me and keep it closed. Shouldn't be too long. In the meantime, I'm going to take your, okay, so 36.5, that's a great temperature. All right, I'm going to take your pulse and your respiration rate now. Is that okay? Okay. Just relax. Just breathe normally. Okay, perfect. And then I'm going to take your blood pressure reading as well. Sorry, I know that's quite loud. You just relax your arm. And if you can just raise your hand and then pump your fist like this 10 times for me. Okay, perfect. Temperature is 36.5. Blood pressure is 120/80, which is very good. Heart rate is 60 and respiration rate is 16 respirations per minute. Okay, so next I am going to start your eye exam, and I'm going to start by inspecting your eyes. So just stay the way you are. I'm going to come up close to you and just looking for any edema or swelling or any nodules. Look at the color, any protrusion. Okay, I'm just gonna do some measuring. I'm going to measure this eye over here and this one here on this side. Okay, so your eyes are perfectly symmetrical, no redness or puffiness or swelling or any of that kind, so that's perfect. Can I just have you close your eyes for me, just like this? And open. Okay. Okay, good. Perfect. Both fissures are symmetrical. Look at your eyebrows. Okay. Eyebrows are full and evenly distributed. No lumps or swelling or edema. No ptosis or exophthalmos. Okay. I know they sound like big words, but honestly it just means that there are no abnormalities that I have noticed. Okay. So I'm going to just put on my gloves, and next I'm going to inspect your sclera and your conjunctiva. Okay. This is a fresh, clean pair of gloves, sterile. So you have nothing to worry about. I'm just going to depress your eyelids, and if you can just look up for me. Okay. Good, and then look over to your left side. And then to your right side. Okay. All right, looks good. So next, I am going to palpate your eyelid and your lacrimal duct. Yeah, so just close your eyes. Perfect. Okay, perfect. So no swelling or edema of any kind that I have noticed? Was there any pain or tenderness when I was palpating or touching? Okay, good. No pain or tenderness. There's no abnormal lesions or swelling or nodules. Your sclera is perfectly white and it has normal vasculature, which is very good. And no redness as well, and no, your blood vessels look good as well on the outside. Okay, so next I am going to be inspecting your pupils. Okay, so here is my Snellen chart, and at the bottom there is a pupil gauge. So I am going to be comparing these pupil sizes to your pupils. Okay. So your left eye, about 4 millimeters pupil. And then your right eye, about 4 millimeters as well. Perfect. So no asymmetry there. Next, I will be inspecting your cornea, your iris, and your lens. So I do need to turn off the light for this one. Is that okay? So I know it looks very dark, but I am going to be shining a light laterally like this from an oblique angle. I'm just going to be looking at your left eye here and your right eye. Okay. All right. So your cornea is perfectly translucent, smooth, no opacities, lens avascular, no opacities, iris clearly defined, no shadow. Yeah, that just means that I did not notice any abnormalities or any solids or anything like that in your cornea, lens, or iris. So next I will be checking for your corneal light reflex, and all you have to do is look directly into my pen light, just like that. Yep. And I'm looking for the little small specks of light, and they are perfectly symmetrical. Good. Awesome. Specks of light. Okay. Next, I am going to check your pupillary reaction to light. And so I'm going to shine it in one eye, and then the other eye, and then shine into one light while looking at the other eye, and vice versa. Okay? All right. So I'm just going to start with direct. Okay. Good. Other side. Okay. Now I'm just going to cover, sort of create a bridge between your eyes. I'm just going to look at this one here. Make sure that there is a consensual reaction. And then the other side. Good. Perfect. Positive, direct, and consensual response. Okay, so I'm going to turn the lights back on. Hope that's not too bright. Is that okay? Okay. So next I'm going to be doing a near reaction convergence test on you. And all you have to do is look at my pen here and then look at the wall when I tell you to. Okay. So look at my pen, back at the wall, the pen, back at the wall, and then I'm just going to come closer. Okay, perfect. All right. Your reaction is normal. No asymmetry, problems, constricting, and dilating. Okay, so the next test is called the H test, and this is a very, very simple test. All you have to do again is follow my pen and don't turn your head. Just keep your eyes only moving. So only your eyes should be moving. Okay. So I'm going to start back here actually. So just follow the tip of my pen. It's called an H test because I'm making an H. Good, perfect. So your muscles around the eye are working perfectly. I haven't noticed, any nystagmus or any ptosis, which means any drooping or any kind of involuntary movement. That's very good. Okay. Next, I'm going to do a cover-uncover test, and this is also quite simple. You just have to look far into the distance on the wall back there, okay? Good. Okay, perfect. And finally, we're going to do the visual acuity test before we move on to some other tests. And this one is also, I'm sure you're very familiar with. I have my Snellen chart behind me, and I'm going to have you cover one eye, so cover this eye. And you're going to look at the lowest line that you can read clearly. Which line is that? Number 9? Okay. So just read it from left to right. Okay, perfect. Now I'm going to have you cover the other eye and do it again, the lowest line that you can read clearly, except now you're going to read backwards. Can you do that? Okay. So, number 8. Okay. I think you can actually try the lowest line. Yeah? Okay. And also backwards. So I actually noticed that your eye is 20/20 in both eyes, and that's really impressive considering you don't wear any contact lenses either. So I'm sure you've been taking really good care of your eyes. Probably good genetics too in that department. Yeah. Okay, and the next test is called the visual fields test. So I'm going to have you cover this eye here, and look directly into my eye here with your opposite eye. Yep. And I'm going to raise my hand and show you numbers, the number of fingers, and you will let me know the number of fingers that I have put up. Okay? See at the same eye? Yeah? Perfect. Okay. So now we're going to switch to the other eye. And you're just going to stare right into this eye. Yeah. Stare right into my eye. Three, 1, yep. 2, Okay, so I noticed that your peripheral vision is completely intact, so that's very good. Okay, and then we're going to do an Amsler grid test. Are you familiar with it? No? Okay. Well, it is also very simple. I'm just going to hold up this Amsler grid, and you're going to look right into that black dot. Just keep looking at it. I want you to cover one eye like this. And keep looking at it. Okay. Now I want you to cover the other eye. Like that. And look at the black dot again. Okay. Keep looking at it. Okay. I have a few questions for you. So, did you notice any distortions or waviness or any blurred out, darkened areas at all? Were you able to see every clear square and the edges? Yes? Okay, perfect. Normal Amsler grid test. No sign of macular degeneration. Okay, and last but not least, we are going to do an ophthalmoscope exam. Now, this one requires me to turn off the lights again. Okay, so this is my ophthalmoscope, and it is a panoptic ophthalmoscope, and I have sanitized that end for you, so don't worry about that. I'm just going to turn this on. I will tell you that the light can be bright, and for long periods of time you might feel discomfort or eye strain or anything like that, so I just want you to let me know so that we can maybe take a break and get back to it. Okay. Just gonna turn it on. Okay. And I'm going to be looking right in to your eye and coming right up close. Okay. Alright. Wow. Your eye does look very beautiful. Did you feel any discomfort at all? No? Okay. So I'm going to move on to your other eye. And just going to come closer again. Okay. Looks very good. No issues. Beautiful retina, immaculate fovea. Okay. So I didn't notice any abnormalities at all. Let me just write all of this down as well. So I noticed that the nerves and the blood vessels and everything in there is completely normal, nothing dilated, no sign of glaucoma that I can see of, but I'm going to let Dr. Patel know and make sure that she double checks that also. And she may do some other tests, such as checking for your intraocular eye pressure. Yeah, I know the test is a little uncomfortable because there's that puff of air that comes. I know. But don't worry, I haven't seen anything abnormal right now. Okay, so I'm going to go ahead and turn the light back on. Okay, so I am so pleased that you came in today and that you care so much for your health and well-being. It really is amazing to see that. And I would love to see you again sometime. I'm going to go call Dr. Patel, and in the meantime, I would love for you to just relax and make yourself feel at home here. Let me know if you need anything at all, or I can get the receptionist to come over as well. And yes, thank you very much for your time today.